Just around back here.
Okay.
The NHS has had a history since it established in 1948 of having a global workforce, because actually we recruited doctors from the Indian subcontinent, we recruited qualified nurses and midwives and health visitors from the West Indies. So we've had a whole 60 years plus experience of having a diverse workforce, but what we recognise is that we need to sustain that, but also we need to make sure that the diversity is at all levels. The more diverse a top team is, the more richer that organisation is going to be in terms of the way it develops service provision, the way that it develops its policies around workforce development. So I think it's really critical that all organisations reflect that diversity right from the board level all the way down to frontline staff.
The equality and diversity agenda, I think, has been promoted in the public sector largely through a partnership arrangement with trade unions and managers and staff within the NHS, because there's a common approach that we want to take about equality and diversity.
The Breaking Through programme supports individuals in a number of ways. Not only does it have the secondment and the educational parts to the programme, but it supports people with coaching and mentoring, which makes a significant difference to them. We would like to see nationally more individuals applying to the programme from the North West, and also we would like to start to work with organisations in the North West to make sure that they are focusing on their own talent management.
Right, tell me, what brought you here today?
I've got a bit of sore throat at the moment.
Okay.
My current role is a candidate of the Breaking Through programme, but I come from a surgical background. I was a Year 1 registrar ENT before moving into this role. The difference it makes me, it gives me the opportunity to make that shift from being clinicians. It gives me the chance to do that. A lot of candidates being from managerial background or clinicians background have difficulties in accessing higher level jobs or jobs that they want to experience or push themselves, stretch themselves to experience. And Breaking Through programme will allow them to do that.
Being from BME community, black and minority background, this opens up a door of opportunities to you, and you feel positive about the future, you're optimistic and you're more confident.
The Aspiring Directors programme has been absolutely fantastic. I was fortunate to get a place on that. I spent 10 months on that programme learning about leadership, understanding some of the requirements that you would have within a leadership role, preparing me to be an executive director, thinking about some of the issues and the challenges that may pose.
At the last minute, it was
one of the missions of the Skills Academy for Health North West, and this is a key priority for NHS North West as well, is for us to really engage with all sections of the community. And we know that we have to work harder to reach further into some communities, and particularly some of our BME communities. So we've got to really work hard to make sure our programmes are attractive, equip people with the skills that employers are needing.
The Skills Academy is a health informatics course which I have completed at Knowsley Community College. After 2 days placement from a women's hospital and also injury hospital, it allowed me to apply for jobs for another trusts, which I am working for the NHS at the moment, Trust Liverpool PCT, and it's going well, and I really enjoy it.
In terms of our commitment for staff in the North West, we're really sort of passionate about making sure that we've got a workforce that's truly diverse and sort of reflects the population that we serve. And the reason that we're passionate about that is that the NHS belongs to the people. It belongs to the people of the North West, so that we know that if we've got a diverse range of people working in there that are able to offer the services to the best of their ability and a high quality, that we know that's going to deliver high quality care for the patients and people in the North West.